Hello, my name is Julie MITTS. I'm a fourth year BSCN student, and today we'll be discussing my change project, Pediatric Medication Safety. The clinical placement area in which this change project will take place is the Pediatric Unit, Kid 10, at Kingston General Hospital. It was first noticed that nurses on the unit do not always verify the safe doses for each patient based on their age and weight, as many believe that they have given these medications so many times before they do not believe that they have to check it as they know the dose is correct. Also, they do not always document discussions with physicians regarding the dosage as to whether or not the doses are safe. As a result, the project focus is ensuring nurses engage in the routine practice of verifying the safety of their medication, as well as documenting physician discussions. According to DeConcilio, medication errors cause over 672,000 injuries and 98,000 deaths per hospital, and medication errors in the pediatric population are more likely to cause harm than those in any other population. Pediatric medication forms are not always available, which makes it essential to perform the drug calculations, and as a result, they are prone to more errors from the inaccurate dosage calculations. In order to reduce the risk of error, it is important that there be adequate material for medication administration, and they must be displayed in an area where meds are prepared. Proper dosage calculations must be performed and enforced, as well as interprofessional communication must be performed in order to notify others of concerns with the safe doses. This change project involves two proposed behavior changes for the nursing staff and are as follows. At the beginning of each shift or prior to the first medication administration of the shift, nurses will verify that medication doses are consistent with safe dosage via patients' ages and weight, as well as nurses will document in patient charts all discussions with physicians with respect to concerns that an ordered medication dose is inconsistent with safe dosage via patient's age and weight. The change theory used for this project is Cotter's 8 stages of change, and the project will be implemented as follows. So a sense of urgency was established as there is the potential crisis of medication error and harm to pediatric patients if the medications are not properly calculated. A powerful guiding coalition will be performed, including the consolidating nursing student, the preceptor, the clinical educator, as well as the unit manager. And the student will communicate the change project to these individuals and work as a team in order to effect change among the nursing staff. A vision will be created and will aim to enhance staff knowledge on safe dosage and provide skills and resources for safe dosage calculation. The vision will be communicated through the coalition staff and through communication board postings, posters, and daily interaction with staff. We will empower others to act on the vision by creating simple posters that are available to all the staff and that are accessible, as well as identifying additional barriers for the staff in order to determine why these dosage calculations are not being performed. We will create short-term wins for the staff by increasing their knowledge, increasing a sense of safety when administering and calculating the dosages, decreasing errors and near misses with medication, as well as including staff input throughout the project. We will produce more change by educating and providing to new staff and nursing students the safe dosage calculations and the importance, as well as nursing staff will encourage new staff and nursing students to implement this change as well. Quarterly surveys will continue in order to assess the change in behavior, and this project will hopefully become institutionalized as it is a job requirement and it must be reinforced. As a leader, the change project will first be communicated with the key stakeholders in order to inform them and receive support and approval. In order to have accurate number and verify the change in behavior, pre- and post-implementation of the project, a survey will be distributed inquiring about whether nurses check their doses consistently, reasons for not doing so, and accessibility of resources before implementation of the project. Education on medication calculation will be provided through posters in a simple and easy to understand way that is accessible and visible to all staff, as well as ensuring that the medication calculation resources are easily accessible as well. The student will also lead by example in order to show others the correct and proposed behavior change. Finally, a survey to examine whether a change in behavior was successful will be performed by asking the same questions as the pre-implementation survey. Democratic leadership will be utilized in this change project. Those who utilize democratic leadership style allow people to plan and do their work themselves in a way that people are more engaged in their work and more likely to perform. It provides the opportunity to prove self, which can be accomplished through this project, as it allows the employees the opportunity to prove that they can safely perform safe dosage calculations and documentation. It also allows shared responsibility with the followers, as it is ultimately their responsibility to check the dosage and view the educational posters. Democratic leadership is often used to keep employees informed about policies, which this change project informs about the policy of safe dosage calculations. It encourages decision-making about the use of resources and accessibility and usability of the resources to perform safe dosage calculation, and provides a sense of personal satisfaction and self-growth from the employees knowing how to perform the safe dosage calculations. The following members are all key stakeholders and would have a vested interest in the change project. The clinical educator provides education to staff and keeps current on organization policies and best practice in order to improve patient care. By implementing this change project, it provides the opportunity for educating staff and reminding staff of the policies. The unit manager oversees all aspects of the unit and supervises nursing staff and patient care. If this project can decrease med errors and near misses, the manager can be confident that medication administration is being performed in a safe manner and increases patient care quality. The nursing staff, through education, will be provided with the skills to be competent and accountable with their medication administration, which are core components of the nursing profession. Finally, the preceptor is part of the nursing staff and therefore would also require the skills to be competent and accountable in medication administration. This section focuses on the organizational structures on the unit and at KGH. So unit managers make decisions and staff input and decision making are considered, making this organization decentralized. They do not always need input from upper management when implementing changes and decision making, and allows employees to make decisions within the organization and develop policies and procedures in collaboration with management. The highest management required for the approval of this change project would be the unit manager and clinical educator, as it is a flat structure. And the project will most likely be supported as it shows accountability for the implementation of this project and allows the staff to improve their practice and ultimately encourages staff autonomy. This Gantt chart is a timeline to keep track during the project and to show the progress of the project and ensure that the project stays on track. The overall breakdown of the timeline is as followed. Stakeholder notification will take approximately 9 days to complete. Pre-project survey will take approximately 9 days to complete. Poster creation will take approximately 5 days to complete. Observation of staff behavior change will take approximately 15 days to complete. And finally, project survey will take approximately 34 days to complete, as the post-project survey will be created at the same time as the pre-project survey. Each section of the program logic model has been covered throughout the slideshow, and the focus of this slide will be solely on the evaluation process. The pre and post questionnaire will help determine whether nurses found a behavior change in this cell from the beginning of the implementation of this project to the end. Student observation will also be performed in order to determine whether there's an observed change in staff behavior from the beginning of the project to the end. Finally, unit manager feedback on medication errors and near miss pre and post initiation of the project will also be evaluated. The preceptor has been made aware of this project and offers her full support and guidance throughout the implementation. This has been an overview of my change project. Thank you.